Coming up, we'll be on location at Nova Affordable Dental Implants in Manassas, Virginia, discussing the latest advances in dental implants and how they can help restore missing teeth, improve your oral health, and give you that beautiful smile you've always desired with one of this area's top dental implant surgeons, Dr. Abdul Rauf Suwid. Welcome, Dr. Suwid, to the Top Doctors Interviews program.
Well, thank you for having me, Nicholas. Thank you so much. I was looking forward to this.
We've got a lot to talk about. There's been many advances in dental implants that can really help people restore their smiles, get their teeth back, get their confidence back. But before we get into that, Dr. Suwid, I wanted to touch on your background a little bit. You're recognized as a top dentist throughout the Northern Virginia area. You've helped so many people improve their smiles, their oral health, regain their confidence, get their teeth back as well. You're a specialist in dental implants, and you really do a great job. You have some of the cutting-edge, state-of-the-art technology here. So I wanted to begin by asking you about your vision for your practice.
Well, I'm happy to be part of this community and very thankful. And we're here for the patients to provide them with a high level of care, and we treat every patient as a member of our family. Years ago, when we decided to open up the practice, we were looking for a modern, clean, and advanced practice that not only meets but exceeds our patients' expectations. We're here creating an environment to promote, say, a lifelong relationship that built on trust, confidence, and exceptional care. Here we invested in advanced technology in the dental field. We have digital x-rays, CT scans, intraoral scanners, smile design, microscopes, and in-house lab. All this together, of course, that gave us the opportunity to be more precise in treatment planning and in control of our outcomes.
Yes, you're definitely providing great outcomes for your patients. The patients love you, Dr. Suwid, you and your practice. They love coming here. It's such a modern, state-of-the-art practice. They don't feel the anxiety that you normally get when you go to a dental practice. Now, to dental implants, what exactly are dental implants? We hear the phrase a lot, but can you tell us what it specifically is?
Great question, and been asked a lot by our patients. We can say it as simple as it's a screw-like post or component made mainly of titanium. We place it inside the jawbone, and that serves like a tooth root or an anchor or a foundation for the restoration that we're planning to restore, whether it's a single tooth, whether it's a multiple implants, or full mouth rehab.
And what kind of problems can dental implants address?
That's a great question. Dental implants are designed to restore missing teeth and also restoring, of course, the aesthetic and the functionality, whether it's a single tooth, multiple teeth, or like a full mouth reconstruction. By restoring this, here in the office we see a lot of patients where they're missing most of their teeth, or like totally edentulous, like they're missing all of their teeth. Missing teeth, they cause the face to sag and appear sunken. So by restoring the implants, it gives the face the structural support and restores the normal face look of our patients. The patients, they gain their life back, they gain their confidence back, and we have a lot of happy stories to tell about this.
Oh, that's great, because you're literally changing lives, Dr. Suwid.
Of course.
And then, not to mention, they can eat the foods that they want to eat again, because when you're missing your teeth, you're very limited. It has to be like soups and
absolutely.
Yes. So many of our pleasures of life come back to us.
I always say to the patients that the complete denture, they're meant to be as an aesthetic only. They're not functioning. So it's a good replacement is the dental implants treatment.
And how is a dental implant procedure performed? So when a patient comes in, what can they expect?
If it's a single tooth, I would say it's a straightforward procedure done under local anesthetic. We lift the gum, place the implant, close it. Takes about 30 minutes, start to finish, an average. The downtime of it, it's I have patients where they go back to work the same day of procedure. Most of them, they do just fine with over-the-counter analgesic, whether it's Motrin or Tylenol. I usually tease the patient if they're coming with an experience of extraction. I'd say extraction is way harder than placing an implant itself. So they should expect a simple and easy procedure placing a single implant. Having said that, now it's different than Olonex. And I can show you one of the patients that came to me, like his general dentist said, like you have to remove your teeth, they're all decayed, non-restorable, and we're going to give you a complete denture. He came to me in the office. We sat together, we took a CT scan, and we examined his smile. We did a smile design, and he was a good candidate for the implant. He has a good quality and quantity of bone, and good quality of gum that supports the underlying bone structure. So after that, we discussed, and as I said, he's a good candidate for all four, and we offered him the treatments. He agreed, day of surgery. We extracted the teeth, and we placed the implants in a strategic position where the restorations or the prosthesis or the denture that's going to come on top of those implants. After that, we placed the implants. Same day, we took the soft tissue impression. We have a photogrammetry technique, which is very advanced in taking an impression and locating the implants. So after that, we designed the denture. Patient, if he's awake, he can be part of this, where he can see, like, he can share his opinions on like which shape and design of the denture. After that, we print out the denture here in house. We stain it, we cure it, and we deliver the denture same day. So patient, he comes here with no teeth, and he walks out at the end of the day with a big smile on his face. Another patient came to me. He sings, in social occasions. He has a complete denture. He came to me and he was complaining that the complete denture is not stable, especially the bottom one, where you have the tongue, you have the muscles. When you talk, the denture moves. It's not that stable, and he was complaining that I want to sing, in social gathering without like me thinking that the denture will come out, which is a huge embarrassment. So again, we sat together, we took a CT scan, and he was a good candidate for the implants, and we went over the procedure. He agreed. So we placed the implant in a strategic position again, took the impressions and delivered the denture on the same day. And as you can see here, the difference, complete denture versus the all-on-4 or all-on-X treatment, it's amazing. We're very fortunate with this technology.
Dr. Suwid, those are great results as we see here on the screen. You're doing some really great work.
Thank you. It gives a joy to our hearts to see this and share the happiness with our patients.
Now, is everyone a good candidate for dental implants, or who would you say is the best candidate?
Good question. I would say every patient who has a missing tooth is a good candidate, as long as they're healthy, they have good quality of bone, and they have a good gum that supports the underlying bony structure. Having said that, it doesn't mean like if a patient has a disease or have a condition, they're not fit for dental implants. No, we can get it done, but sometimes it takes a longer time. Let's say if a patient comes with the uncontrolled diabetic, and what we can do, what we can offer, we usually work with his physician, get his blood sugar in control, and then we place the dental implants. Same thing applies to patients like they're going through a chemotherapy for cancer treatment. We usually consult the physicians. We work with the oncologist, and yes, it takes sometimes a longer time, but at the end we get it done.
And how prevalent is the problem of people missing teeth? Is it millions of people?
I would say yes, and you'll be amazed by it's not only missing like single tooth, it's totally edentulous, like yes, and the numbers are in millions, yes.
Dr. Suwid, you mentioned all-on-4s. Are there different types of dental implants?
Yes, there are industrial implants, which is the commonly used one, which we place in the jaw bone, wait for a certain period of time, like we call it a healing period, which is we're waiting for the titanium to integrate with the bone, and then once the implant is stable, we go for the restorative part, right? Now, this industrial implants can replace a missing tooth, whether it's a single, multiple. We do a bridge. So if the patient is missing 3 teeth, we do 2 implants in the side, and then that replace three crowns connected together. Going into the option of what if the patient waited a long time stayed edentulous and wearing like a complete denture. What happened to their ridge? Well, the ridge will resorb and fade away, and we will left up with no implant, with no bone to place the implant in the posterior area. So what we can do, we can offer them we call it an overdenture or snap-on denture. We place 2 implants in the anterior area, usually in the canine area, and where the complete denture snaps onto those ones. It's not a perfect patient. They have to remove it at night and clean it, but still it's way better than complete denture. And then the final one, the all-in-X or all-in-4 patient, whether they have their teeth non-restorable need to be removed, or edentulous, as long as they have good quality and quantity of bone, they are candidate for it, and it's amazing option to replace their missing teeth.
So dental implants are like getting your own teeth back, Dr. Suwid. It sounds like you can eat again, you can smile with confidence, you get your missing teeth back in your mouth.
Sure.
How long do they typically last?
Again, it's commonly asked by most of the patients, like how long does it last? I always say to the patient, like once we place the implant inside their mouth, they are part of your mouth, as if they're natural teeth. Now, if they're taking good care of their hygiene, they go regular visits with their dentist, hygienist, or periodontist, they brush on a regular basis, they floss, as if they're natural teeth, they last long. I've seen in my long life placing dental implants, I've seen implants that have been placed 20, 30 years. They look healthy, they're functioning well, patients are happy. So again, as long as the patients, they're taking care, maintaining the implants, they meant to be in lifelong treatment.
Oh, that's great to hear. So it is literally like getting your teeth back, because you have to maintain your teeth as well.
Of course, yeah.
And if you don't take care of them, they're going to fall out eventually.
Yeah, same as natural teeth. If you don't take care of them, they got decayed, they got gum disease, you lose them at the end. So same thing.
So say a patient is interested in dental implants, Dr. Suwid, what's the process they can expect when they first call your practice?
Again, we're very fortunate and lucky here in the office. We have a very skillful and experienced team. They will welcome the patients, and they will usually, if they ask common question, they will answer briefly. They're not in details, of course, because they're not allowed to. So after that, they will schedule an appointment for a consultation, and I get to see the patients, answer their questions, see what's their needs and expectations. After that, we take a CT scan. We offer a free CT scan for implant consultations, because I believe it's the safety of our patients is a priority. So we need to know how far the nerve is, the sinus is, are they a good candidate? Do we need a bone graft? Is it straightforward? So once we do the CT scan, we take pictures, we do a smile design and see what patients would expect after the dental treatment. After that, we schedule the surgery and we do it.
That's a straightforward process. What I really like about it, Dr. Suwid, is the fact that you take the time with each patient. You're just not rushing them in and out, because you understand that every patient is unique. Each case is different. So like you said, does someone need a bone graft or not? And your patient care is next level here at your practice. That's why the patients really rave about the whole experience. Not only the outcomes and the results, but how you treat them like family when they come in.
Oh yeah, it's our philosophy in the office here. Patients are a member of our family. We were taking good care of them. Not only that, it's most of them, they have my cell phone number. So once they get into the treatments, we will be one family, that's for sure.
Well, thank you so much for joining us, Dr. Suwid. That was very informative. I want to thank you again for being a guest on our program.
Well, thank you. Thank you so much.